Hello, Karla, are you there?
I am here.
Okay. Hi, everyone. Sorry we were having a little bit of technical difficulties with the PowerPoint slides, so we'll go ahead and get started. Good afternoon. I'm Christine Ortiz-Gamina with the National Environmental Health Association. Thank you for joining us today for the Environmental Health and Emergency Management webinar. Today's webinar is hosted by NEHA and features Karla Black, Emergency Preparedness Coordinator at the Kent County Health Department in Grand Rapids, Michigan. She will discuss incorporating environmental health response to flooding, Ebola planning, and vapor intrusion. Additionally, Ms. Black will provide an overview of Grand Rapids Health Department radiation exercise. A bit of housekeeping: all webinar participants will be in listen-only mode. This webinar is being recorded and will be provided on the NEHA Preparedness page. Also, there will be a Q&A at the end of the presentation, so will everyone hold all questions until then? The Q&A will be conducted via the webinar chat box. Feel free to enter in any questions you have via the chat box throughout the webinar, and we'll address the questions at the end of the presentation. I will now pass it to Karla Black, who has been in the field of public health emergency preparedness for over 7 years at the state and local levels. In the past 5 years, she has written plans, executed exercises, and responded to various environmental health issues as a preparedness professional. So with that, and to ensure we have enough time at the end of the webinar to take your questions, we'll go ahead and get started.
Thank you. Welcome everybody from NEHA. I'm happy to be here. I really appreciate it. I'm sitting here in the wonderful city of Grand Rapids here in Michigan. It's nice and sunny out, and so thank you so much for joining me on this presentation. So today I'm going to talk to you a little bit about how emergency preparedness and environmental health can partnership and have it be successful. And here in Kent County, it took us a little bit of time to get there, to say the least, and some of it was forced and some of it was as the result of disasters. So I'm going to kind of take you through a little bit of what got us there and some of the responses we've had. And sometimes I'm not the nicest person, and I put a lot of our staff photos in there, so if there's anyone from Kent County on the webinar, sorry, your picture's on here. And so I'll also give you a little bit of frame of reference of who we are, so you'll actually get to see a picture of me, or several, so sorry about that. So what is environmental health to your department? You probably have heard the phrase, if you've seen one health department, you've seen one health department. And so thinking about what environmental health is to you, so it could be in your local health department, or it might be a whole separate department on its own. Here at the Kent County Health Department, we have 4 different divisions in our department, one of them being environmental health. And under environmental health, we have a whole range of things. So we have our inspections, so kind of what people take as the traditional environmental health, so the wells, the septics, body art, pools, restaurants, all those wonderful things that are normally associated with environmental health. And that leads to also enforcement. So of course we do close down restaurants as necessary, pools. We've had a couple of those in the past week that we've had to do. But what's a little bit different for our environmental health is that we have a laboratory and also the animal shelter. The laboratory actually takes care of water testing, so the public can bring in water samples from their wells, and we will do water analysis, whether to look for coliform bacteria or start looking at metals. And also we've done some lead testing, so a lot of different things, but also we do a couple of clinical specimens as well, specifically in the STI arena. So we have a laboratory, and it's in-house, and it's actually in our building. But then also we have the animal shelter as part of environmental health, and that also includes animal control. So that makes things a little bit challenging for us sometimes when it comes to planning emergency preparedness and response, because animals are a little bit different when it comes to all the planning. And so having that in our environmental health division has made things a little bit challenging for us, but it's made us grow and learn, and you'll hear a little bit about that when we talk about some flooding. So coming from an emergency preparedness perspective, that's where I'm from. So I'm the Emergency Preparedness Coordinator, so my job is to work with all the different divisions within the health department and make sure we're prepared and able to respond when anything happens that has a health bend to it. And as an emergency preparedness professional, kind of what we lean on is this lovely document known as the Public Health Preparedness Capabilities. And these were dated in March 2011. And actually we're going to be getting some new capabilities here in hopefully a month or two from what we hear from the CDC. And so this is kind of our go-to guide as emergency preparedness people. So I just want to make sure that you can see that. And then the capabilities that we've been charged with are these lovely 15 capabilities. So I'm not going to read them all off to you, but if you do a quick scan of these 15 capabilities, you probably notice that there is not an environmental health capability. And to me, and I'm going to get on my soapbox here for a minute, that's very detrimental for me as an emergency preparedness coordinator and for our partnership with environmental health. Because a lot of what we are told to focus on as emergency preparedness coordinators is putting pills in people's shots and arms, and that falls a lot under capability 8 and 9. If you've worked with your emergency preparedness staff, you've probably heard about points of dispensing known as pods or the strategic national stockpile. That's really our bread and butter, and that's what we've been told to work on. However, and I mean, because that's really what's in the capabilities. However, there really isn't any sort of focus on environmental health. There are little pieces and parts. If you look at capability 13, public health surveillance and epidemiological investigation, there is a little bit of environmental health under that just because of investigation, and so environmental is included in that. But also along with that, number 7, mass care, brings into like the inspection part of looking at shelters, and so that's what our environmental health has done in the past. But there's no specific environmental health capability, and I would really like to see that happen at some point in time. So when I joined the Kent County Health Department in 2012, we were starting to go down the road of looking at FAB accreditation. So if you're not familiar, that's the Public Health Accreditation Board, and that's national accreditation for local health departments and also state departments as well. And we were starting to look at that, and then also my health officer at the time came to me and said, well, hey, I heard about this thing called Project Public Health Ready. And so I took a deeper dive into it, and it's from NEHA, and basically it's kind of like the FAB accreditation for local health departments in their public health emergency preparedness. And so trying to be efficient, if you will, we started going down that road of FAB and Project Public Health Ready, known as PPHR, at the same time. And so to give you kind of an idea, because at this point we were still very siloed between emergency preparedness and environmental health. And so these two accreditation products really kind of pushed us forward into looking how we can partner. So looking at FAB, I'm not going to go through a lot of what's in FAB per se related to EP and environmental health, but I just wanted to give you a starting place. So if you want to go take a look, you can go into the FAB standards and measures, and they're available online. But really what connects environmental health and emergency preparedness is domain 2. And that's looking at the health problems and environmental public health hazards that are involved in the community. And specifically kind of where we've been looking at for us is Standard 2.1, and Standard 2.1 has a lot of the plans that are required, which at the time when we started down this road, we didn't have a collaborative emergency preparedness and environmental health plan. And so that really forced our hand on that. But then looking at Project Public Health Ready, it forced our hand even more to get this done. So on your screen in the background is the section of Project Public Health Ready that deals with environmental health response. Section R1 contains everything that's cross-cutting, so that means that it should be in all of your plans. So the staff roles and responsibilities, when actions will occur, under whose authority. But then it goes into more of the specifics of what you should be working on and what should be included in your plan. And that's in that section that's a little bit forward on your screen. So R3.1 through R3.9, or actually 11. So we had to have plans put in place for all these things. So foodborne, waterborne, vector surveillance, food safety, wastewater, solid waste management, air quality, all these things, which we didn't really have in place at the beginning. We had, as emergency preparedness, we had response plans, but environmental health had more specific plans. So we had to meld those together into a more usable plan for both of us. And if you're interested, you can look on the NEHA toolkit, and our environmental health response plan is on there, and you can search by state. And so if you look under Michigan, you might be able to find it through there. Or at the end, my email address pops up, and if you'd like to see our plan, I'd be happy to share it with you. So that's kind of what all started this. So this was around 2013 that we're really getting into this. And that's when a lot of our disasters started. So one thing that we definitely decided is that we really have to use incident command, and everyone needs to be knowledgeable in it. If you're not familiar with incident command, I highly, highly recommend that you take the incident command classes through FEMA. They're free, they're online, and they take a couple hours, but in the end you get a nice handy-dandy certificate. And there are 4 classes for incident command, and that's ICS 100, 200, 700, 800, and at the bottom of your slides there's the web address for those. But incident command is a standard way of handling incidents. We've been told through our grant for the Public Health Emergency Preparedness Grant, known as the FEP grant, that you have to be NIMS compliant. So each of our staff have taken each of those classes, 100, 200, 700, and 800. It establishes a common language for us to utilize when it comes to emergency preparedness and response. And since almost everyone is trained in this, hopefully you are too, that if I come to your state to help you out, you know what incident command is, and I can jump in and help you with your incident. But it's expandable. And so on the picture on the screen, I have just a general incident command chart, nothing too fancy here, but these are kind of the 8 basic positions of incident command. For a quick refresher, if you don't know, or if you don't know incident command, the incident commander is the lead of the incident. They are responsible for everything. And they can then parse out different sections to other people. So the public information officer, they're the ones that deal with the media, trying to make sure that everyone has the correct message and has that good media contact. The safety officer is an interesting one because they're the ones that are trying to make sure that the responders are safe. They're not really so much concerned with the safety of the populace, but they're trying to make sure that the operations of the event are smooth and safe for the responders. The liaison officer is responsible for interacting with all the different agencies that are involved in the response. Because if you've ever been involved in a response, usually it's not just the health department that's involved. You have lots of different people involved, including, it might be your state, it might be community organizations, it could be your fire, it could be law enforcement, it could be hospitals, it could be any number of organizations. So that liaison officer is charged with trying to make sure that everyone is on the same page and operating off the same set of sheet music. Then you get down to the bottom, and these are our 4 main sections. So the operations section is the boots on the ground. How are they handling things? They're the ones that are handing out the pills, shots in arms, or if you're in environmental health, if you have some sort of foodborne response, they're the sanitarians going out and doing the inspections. So they're the doers, if you will. And then, of course, there's the planning section. So you have to have someone writing the plans and ensuring that you're all marching to the same beat. So that's what the planning section does. Logistics, they're the ones who get the stuff for you. If you need thermometers or whatever you might need, logistics is where you get your stuff. But then somebody, of course, has to pay for it, and so that's the finance admin section. So if you're not super familiar with incident command, I highly recommend that you take those training courses, but I'm just going to talk you through a way of how you use incident command and you don't even know it. So you have a fire in your kitchen, and it looks like this. So it's not a huge fire. You can probably put it out yourself, and hopefully you're prepared and you have your own fire extinguisher in your kitchen. So if you're in incident command with yourself, you are the incident commander. You don't have anyone else there, and so you are going to assume all of the roles. So that means that you're the incident commander and that you're the operations, the planning, the logistics, and the finance admin. So in terms of looking at this fire, you're looking at it and you're like, okay, my plan, so planning section, is to put the fire out. And then you're like, well, how am I going to put that fire out? So you think, okay, logistics, so I'm going to go get my fire extinguisher. And then you actually take the fire extinguisher and do the operations section's job of actually putting it out. But then, in the end, if there's any damage, you have to be the finance admin person and actually put the fire out. So that's kind of how you can think of incident command on a normal day-to-day basis. But let's say now that your fire looks like this. Ah, horrible. So now that your fire looks like this is when you start calling in other people. So this is when you call the incident commander because you are the person on scene at this point, and so you're going to call 911, hopefully when your fire looks like this. So when you call 911, the fire department shows up. And so at this point, you can transfer command. So the incident commander is now from the fire department. So then they take over everything else. So then they have the logistics, they do the plan for how they're going to put it out, and then they actually do put it out. But unfortunately, you're probably still going to be the finance admin section chief for this because the fire department's not going to pay for your stuff. So you're going to have to work with insurance to take care of that. But that's just kind of a quick and easy way of thinking about how incident command works. So as we were doing all of our plans and everything back in 2013, we're getting all of our plans together, we're getting ready for PPHR and FAB, and we're feeling pretty good, but then along comes a flood. So in 2013, we had some pretty nice flooding here in Grand Rapids and in the surrounding counties. And so for us, this was April of 2013. Our City of Wyoming declared a state of emergency, followed by on April 19th, Kent County declared, and then on the 20th, the City of Grand Rapids declared. And for us as emergency preparedness professionals, declarations are not like, oh, we can't handle this. What the declaration does, it opens up the money. So if you don't have a declaration, you're not going to get money. And so as we declared, other counties around us were declaring, and then finally on May 7th, the state of Michigan declared, and then that led to a national disaster declaration, so then we could actually get FEMA reimbursement money. And all of that money is based on how much money your state pulls in. So for us, I think you needed about $11 million at that point to get a federal declaration. And so in Kent County alone, we had $8 million in private property damage along with $2.6 million in public property damage. So we almost hit that $11 million mark on our own in Kent. And at this point in time, we were still kind of getting into incident command, and we were trying to figure out how we're going to do this. And so our first time, well, my first time here at Kent, and then also our health officer at the time was our interim health officer, so we were kind of like, okay, how do we do this? We just took these ICS classes, so how do we pull everyone together and figure out what we're going to do? So we established our response objectives, and those we made them very simple and very broad. So ensure the health of responders and the citizens in the affected areas of Kent County, communicating key public health and safety messages to the public and responders, and then assessing and monitoring emerging public health threats. So these are really broad, and we just felt that could lead to any number of things. And if we had more specific ones, we could add them, but since we were just kind of starting out, we figured broad might be easier in this case. And so we started setting up incident command. So here is what our incident command chart looked like. So at the top we have our incident commander, who some of you might find familiar. That is Adam London, who is the immediate past president of NEHA, and he is my health officer. So he was he was interim at the time, and he just become interim, I think, maybe 2 weeks before this happened. And so we're both sitting in the Emergency Operations Center through emergency management, and we're talking about, okay, well, how are we going to set up incident command for this? Because, like I said before, a lot of our plans had been put in place for putting pills in people's shots and arms, not necessarily for environmental health response, because that's what this honestly was. And so him and I were talking, and so we established him as the incident commander, but I believe at the time he actually had to go out to Denver for something at NEHA during part of this response, and so he established a deputy incident commander, which is Dr. Mark Hall, our medical director. And as we're kind of going through this, of course, our public information was very key. We wanted to make sure that the public knew where it was safe to go and what they could do with what they had in their houses, because there's a lot of questions about mold. Can I eat this food that's been in a can that's been underwater? All these different things. So public information was key, and that's Lisa LaPlante, our former public information officer. And just because I'm in the emergency preparedness role, they felt that I would be a good liaison, just because I know a lot of the different people in the preparedness community. And then safety was of utmost importance because we were going to be doing a lot of water sampling, and so we wanted to make sure that the operations section was safe. But if you notice, the picture of me on there, I'm on there twice. And so I was also established as the planning section, and one of our lessons learned was don't do that. I thought I could handle both and do them well, but unfortunately that was not the case. And so I'll show you a couple other incident command charts here later in my presentation, but no longer do I do both. I usually just sit in the planning section now. Logistics was Pat Draper, who works for me. She's our emergency preparedness specialist, and we actually had Portia Yarborough, who's under her, to set up a telephone call-in line, so if people had questions that they could do that. Gail Brink is our finance person, so she was obviously finance admin, but where things get interesting is the operations section. So Sarah Simmons was our supervising sanitarian at the time, and since Adam had just become the interim health officer, she took over as operations for environmental health. So let's look at what she had to do. So under her, we had several people. So Carly Lutman is our animal shelter supervisor, and this was the most interesting part of all of this, at least from my perspective, because there's a picture of cows up on your right-hand side, and that's because, of course, everything bad happens between 4:30 on Friday and about 8:30 a.m. on Monday. So, of course, on Saturday, we get a phone call from emergency management saying, hey, we have about 40 head of cattle that are being pushed up against the fence, and they might potentially drown because the waters are rising. And when I heard that, I said, you said 4, right, not 40. I'm hoping I just misheard you. And they're like, oh, no, you didn't mishear us, 40. And so we actually had to work with the surrounding farmers to see if they could take the cattle around. But otherwise, that turned out okay. But also we took in 6 cats, I believe, for our animal shelter. So we had an animal branch. But then we were worried about food. And the food we were worried about, because in the flooded areas we were having a lot of restaurants that were being flooded. So Shane Green, our food supervising sanitarian at the time, was looking at different GIS maps to see who was affected, and they were going out and doing restaurant inspections to make sure that they weren't prepping food in flooded areas. And then, of course, shelter was a really big one. We had 3 shelters open during our floods, and Steve Petridis went out and every day checked the food of the shelters and made sure that everything was in compliance with CDC's checklist. And then finally, water. We had a lot of wellheads submerged during our floods, and so Mary Reading was making sure that people that had their wellhead submerged knew that they had to get their water tested and by our lab, and that would be Erin Lammers, her picture right there. So that's kind of how we set up our incident command for our flood, and it worked out really, really well for us. It just really kept us on track with what we needed to do, and it gave us a really good foundation to get through the event. And actually in 2018, this year in February, we had floods again, about the same level, but because of mitigation and because we had been through this before, we honestly didn't really have to set up incident command, because we've been in incident command so many times since then that this was really simple. So where have we collaborated in terms of emergency preparedness and environmental health? Well, it's usually been those natural events, flooding and tornadoes. We've had several of those over the past couple of years. That picture of flooding up there is our flooding in February during 2018, and then we had a tornado in 2016 that actually hit where I lived, and so my environmental health food supervisor was on the phone with me, and he's kind of like, okay, well, what restaurants have been affected? Let's get a map going. And so he started figuring out what restaurants were impacted and made sure that all of them were operating safely, or if they were without power, that they had to throw their food out if it was over the allotted amount of time. But then, of course, we always had the foodborne outbreaks as well, so that's really been kind of the majority of our responses together. However, it's not always just straight environmental health that we've dealt with. We've had that intersection between environmental health and emergency preparedness. There was also good old Ebola. So if you're in the public health arena in 2014, 2015, Ebola was certainly the hot topic back then. And while in Kent County, Grand Rapids, we never had a single case of Ebola, which I'm very thankful for, there was a lot of planning that went into it. And so we actually established Incident Command specifically just for planning if we were ever going to have a case or just getting ready for it in general. So this is what that looked like. And you're going to notice that as I go through some of our Incident Command charts, you'll see a lot of the same similar faces, but some change. And so in this case, this was an infectious disease. And so it wasn't specifically an environmental health response. It was pretty much a whole health department response in this case. So you have Adam London as our incident commander. We had hired a deputy health officer, Teresa Branson. She became an deputy incident commander because this lasted so long that we might need some extra coverage. And in the flooding one, I mentioned that it was not a good idea to have me both planning and liaison. And so I stayed in planning this time, but our medical director, he has those really lovely letters MD after his name, and so we felt that since a lot of this was going to be in collaboration with the medical community, that he would be the perfect liaison for this incident, or this planning incident, if you will. So we changed that around a little bit this time. And then just because of all the legal implications of Ebola, so isolation and quarantine, we actually added our corporate counsel, Sagita Ghosh, to our incident command. So I highly, highly, highly recommend, if you set up incident command, you consider having your corporate counsel there. She's been absolutely invaluable to us. Definitely one of the best things that we have ever done. So from now on, pretty much, she is always in our incident command structure since then. So you'll see a lot of the similar stuff that we had before, except now we've added a surveillance section. And so under ICS, it says that you can have a surveillance section. It's usually more implied that it's, FBI type surveillance, not, our type of normal public health surveillance, not disease surveillance. But we decided to use it as disease surveillance. And so Brian Hartle then became our surveillance section chief, so he was monitoring all the trends of Ebola. But we still left operations in the hands of environmental health, and we set it up in two different groups. So hazmat waste with Sarah Simmons. So we're looking at how households are now, like if somebody was infected with Ebola and they've been in their house, what do we do with their housing? Like, do we have to throw their mattress away? Or if they threw up in their apartment, how are we going to be involved in the remediation? So that was one group. And then Carly was there again as the animal group, because if you remember, there was the question of the dog in Texas when there was the nurse who had Ebola. And so since we had the animal shelter, we had to try to figure out, well, what was going to be our stance on animals of patients with Ebola. So that's what our incident command looked like during Ebola. So as you can kind of see, so we have floods in 13. Now we have Ebola in like 14, 15-ish. And so, of course, during all this, we have time for an exercise. So the National Guard came to us and they said, okay, we're going to do this exercise called Northern Exposure 2015. And they wanted it to be rather large and comprehensive. And so they involved Kent County, so that involved emergency management, the health department, public works, a lot of our different county facilities, along with fire, emergency medical services, hospitals, our regional healthcare coalitions, state departments. There was everyone involved in this. And it ended up being a really large exercise because of the scenario that they gave us. And that scenario was that an 8 to 10 kiloton improvised nuclear device was detonated in one of our neighborhoods in northeast Grand Rapids. So when they were originally planning this exercise, they told us it was going to be dropped initially at the Gerald R. Ford Museum, which is located right on the river. And so I was kind of hoping that it would be closer to the health department, because I would say, okay, well, we're vaporized and I can just not play. So we'd be done. That'd be an easy exercise for the health department. But unfortunately, they moved everything, and so we were not vaporized. But speaking of vaporization, if the detonation was any closer to the river, that would have vaporized the water, and then we would have had radioactive water going through town through a huge crater. Then who knows what would have happened. And so them moving that was very helpful to us. We'll just say it that way. But here's kind of what it looked like in terms of the different damage levels. So at the half mile, you can pretty much assume vaporization. At 1 mile, heavy damage. And then at 1.5 miles, you have some light damage. Right at the edge of that 1.5 mile is what we consider our medical mile. So they put that just enough so that they could spare us the issue of having to deal with no hospitals. So this was a really large exercise. And again, for us, a lot of our focus in emergency preparedness has been pills in people, shots, and arms. This was radiological. We didn't have a lot of background in how we were going to handle this. And so we, as the health department, took a step back and did a series of tabletops, and we did some full-scale play in our emergency operations center. But one specific thing that we decided to do was have an environmental health tabletop. And basically, this is what our slide deck looked like. So for 3 hours, we discussed the topics that are on your screen: food, water, animal shelter, lab, PPE, and what partnerships we need to have in place. So for 3 hours, we discussed it, and we probably could have easily gone for another 3 hours in trying to figure out how we were going to respond to something like this. So I'm just going to give you kind of a quick snapshot of some of the things that came out of that tabletop. So on the food front, a lot of the questions were, what's safe to eat? So our grocery stores, home gardens, restaurants, and so we discussed through those topics. And then what happens to that food that's unusable? Because that becomes a lot of waste. And where is it going to be disposed of? Especially, where is it going to be disposed so that animals can't get to it? Because that becomes a whole other problem, that scavenging. Or if people don't have things to eat, how can we stop them from scavenging food that potentially might be unsafe to eat? And then along with disasters, a lot of times you see pop-up food operations. And so how, are we going to be able to license them? Are we going to be able to inspect them? How do you tell them no? This is a really big issue. How are we going to tell them no? Because they're trying to just be helpful and make sure people have food when you've had, your entire city destroyed. So how do you tell them no? So that's some of the things that we discussed for that. And then, of course, sheltering. In an event such as an 8 to 10 nuclear device, there's definitely going to be shelters. Well, where are they going to be set up? Well, they're probably not going to be set up in Kent County at that point, but how fast can they be set up, and how are we going to get people there? And do we have the equipment for radiation monitoring? We are within a 50-mile EPZ, emergency planning zone, for the Palisades nuclear power plant, and so they have equipment down south, but how fast can we get that? Will they let us use it? And then how are we going to decon people? Food, keep the food operations as simple as possible and use trusted resources, but with all the people that are probably going to be there, how are we going to deal with waste and pets? Those are some of our really big questions. There is a picture of a guide to operating public shelters in a radiation emergency. It's a really great document from the CDC, and you can get that off the CDC website if you're curious. But the one that really just kind of struck fear into my heart was the animals component of this. Where are we going to put the pets? Based on the scenario that we were given, there was going to be 35,000 shelter people. So that gave us an estimate of about 5,000 dogs and 4,000 cats. Where are we going to put them? How are we going to handle that? And so we started thinking about portable kennels on site, or maybe we just get an off-site venue. And how are we going to monitor and decon these animals? That's going to be a challenge in its own right. But as you know, animals don't always listen, because not all animals are pets. Not even all pets listen either. So what if pets run? What if they're now contaminated and now they might need to be euthanized because they've gotten so much radiation exposure that they have radiation sickness? How do we handle that? Are we going to be able to euthanize, but in a disaster, do you really want to have to tell, hey, poor little Fluffy here, we might have to euthanize your animal? Not really the thing that we want to ever consider, but we're going to have plans for that. What about animals on the loose? Because again, they're not going to listen. They'll probably go into the radiation zone where there's lots of radiation and other things that are contaminated, such as remains, things like that. So how do you stop animals on the loose? So the animals one really got to me. And then finally, laboratory was another big thing. During the exercise, one of the injects was, will the Kent County Health Department take on radiation samples? And honestly, we didn't know if we had the right equipment to hold it. I mean, we didn't know if could we just stick it in a freezer or in a refrigerator? Is that all we needed? What type of samples are we going to get? How are you going to collect them? How are you going to deliver them? And is it an occupational hazard to our staff? So we had a lot of questions during our exercise, and the last couple slides gave us a lot of really good planning guidance for ourselves over the next couple of years, and honestly we're still working on the after action based on that one environmental health exercise alone. So that was 2015. So then, of course, our disaster for 2016 is vapor intrusion. If you've never heard of vapor intrusion, it's a migration of vapor-forming chemicals from any subsurface source into an overlying building, and that's officially from the EPA. So if you're looking at the graphic on the right-hand side of your screen, there's soil that's contaminated with VOCs or in the groundwater, and through cracks and fissures in the ground, or they can rise up through basements and into homes. And vapor types might include, volatile organic compounds known as VOCs, mercury, pesticides. Depending on that type of vapor, you can have a range of hazards. So you can have chronic or acute health effects, but also safety hazards leading even up to potentially explosion. And so the chemical we ended up dealing with for our first vapor intrusion was tetrachloroethylene. And one of our challenges was that there were so many different names for tetrachloroethylene. We heard perchloroethylene, perchloroethylene, PERC, PCE. And so we really had to make sure that we were on the same page in terms of language. So we ended up just calling it PERC. But at the very beginning, somebody called it something different, and then some of us went down a different road thinking it was something else. So we really had to be very mindful of language. But PERC is a solvent for organic materials, so you've seen a lot in degreasing operations, but also specifically dry cleaning. And the health effects of tetrachloroethylene is you can have a central nervous system depressant. It is probably carcinogenic and can lead to Parkinson's disease potentially, and also color vision deficiencies. So we were notified on May 19, 2016 of a former dry cleaning business located at the properties at the intersection of Hall and Madison in Grand Rapids. And what was interesting about these two buildings was that in both the buildings on the bottom floor, there were two nonprofits. And then on one of the other buildings at the top, there were two apartments, and there were 6 residents of these apartments. And based on the levels that we were told of PERC in the indoor air monitoring, that we were going to have to evacuate them. And so our health officer had to sign an order of evacuation and effectively kicking everyone out of these homes, because the state said they have to leave, but they didn't have the authority to sign that order. It was our health officer. So we've displaced 2 nonprofits and 6 residents of 2 apartments at this point. And so, of course, this was a great time to establish incident command. And so as we're thinking about how we're going to handle this, we changed our ICS up a little bit to a medical group, a property group, and we added a social worker. And so this is kind of what it looked like. So again, we had Adam as our incident commander. We had a new public information officer at this time because Lisa had just left. This is Steve Kelso, and then of course our legal was very present because, and I'll get to this a little bit more in our response activities, because people were not happy being displaced from their points of residence or their points of work. But I'll get a little bit more into that in a minute. But just because this operation was a little bit different than most, Adam decided to remain the operations section chief, so he did not hand that part off to anyone else. But we had 2 groups under him. So we had Eric Pessel, who was our property group manager, so dealing more with the environmental health impacts of this at the property, and also making sure that the people were staying out of the property. And also Dr. Hall was the head of our medical group, because we ended up doing some testing. And then under logistics, we added a social worker, Carrie Stelma. She was very responsible for helping out the residents for trying to find places to live. So let's talk a little bit about our response activities on this. So this was pretty complicated. We had never dealt with a vapor intrusion before, and we reached out to a couple other health departments, and we weren't able to find anyone that had really dealt with it. So we actually ended up doing blood draws for the residents and employees, trying to figure out what their levels of PERC were in their blood. And then we ended up working with our local hospitals for referrals. But the really big challenge for us was that the people that lived in the apartment, they didn't have anywhere to go. But technically, they weren't homeless, according to the HUD definition. So we were working with Red Cross, Salvation Army, and the Michigan State Housing Development Authority to try to find them someplace to live. One of the residents was out on social media starting a GoFundMe campaign. It was really challenging. And then if you ever talk to your emergency preparedness people, you might hear something called administrative preparedness, and I like to call that basically getting stuff really fast and paying for it. So several times we had to hurry up and get them hotel rooms because they needed places to live. There were potential lawsuits with this whole situation. The owner of the two apartments actually was a Grand Rapids lawyer, of course. And so he was threatening to sue us because he didn't have his residents in his apartments, and so therefore he still felt like he should be paid, but of course they didn't want to pay because they weren't living there. So there was, and then of course we were the ones who signed the order for them to be out, so he threatened to sue us. And then also we had to do some enforcement because one of the residents kept going back into the home continuously, and so we had to do some work with that person to try to keep them out. We did a lot of public information, and we did several community meetings. The EPA ended up coming in and brought their Taga bus, and so they did a lot of air sniffing for us. And luckily, we didn't really find any more areas in the plume, or at least the projected plume of this PERC. So we were very fortunate on that, and we were able to lift the public health order on July 18th. So the people who lived in the apartments were out of their residence for almost 2 months. But in the middle of all this, we got another vapor intrusion. Of course we did. We never dealt with one before, but now, when it rains, it pours. So on June 7th of 2016, we heard of another vapor intrusion at a former reclamation facility for solvents, and it was known as Trex. And in this case, there was actually a responsible party, so they were still in existence. But this time the chemical was trichloroethylene, which also is a potential carcinogen and can lead to a number of health issues, including potentially like kidney cancer. This was in downtown Grand Rapids. And initially when we heard about this, the different venues that could potentially be affected were the Rapid, which is our mass transit system here in Grand Rapids, along with the Grand Rapids Ballet, and then, of course, the ever-popular Founders. And if you've ever thought that you might have to shut down a very large brewery, it's a very scary thought, to say the least. And we were kind of wondering, well, if this happens, do we have to go to the governor and ask if we could shut down Founders? I mean, because that's a really big deal. But luckily, when the testing came back, none of really Founders was not affected. They just found a lot of VOCs related to brewing, thankfully. However, the Rapid was affected down in the basement, but not in their above-ground offices, so we were pretty fortunate there. But there was also another business in the area known as the Big Event, and they had very high levels of TCE in their property, and so we also signed an order for them to vacate their property as well, and so we worked through all that, and luckily they were not one of the ones that were trying to come back and still work in their property without proper clearance. But again, it took about 2 months for the mitigation to happen. And so the mitigation for this is something kind of like a radon system where there's a vent out and a fan trying to vent all the vapors. So that order was lifted on August 11th, and our vapor intrusion nightmare at the time was at least over, but there's potentially another 3,000 vapor intrusion sites in Michigan, according to the Michigan Department of Environmental Quality. But right now we're a little bit more focused on PFAS chemicals in well water here in Kent County, which I'm not going to be able to get into today, but that's something that's ongoing. So that was our disaster of 2017, and now currently into 2018 as well. So I figure we're good for now. So overall, some of the lessons learned that we've had from our partnership between environmental health and emergency preparedness is that environmental health is an integral part of planning, training, exercise, and response, but also conversely, Emergency preparedness is an integral part of environmental health. We can't work without the other. Environmental health has challenges all the time that emergency preparedness can help with. We can help set up incident command for you and make sure that you have an organized response. As emergency preparedness people, we're not specifically versed in food inspections or anything like that. We're not coming to take over for you. We're there just to help you coordinate and help you get resources, because sanitarians, they are a resource, and it's a very limited resource. And so what can emergency preparedness do for you to try to help lighten that load a bit? Can we, take notes for you? Can we contact people for you? Can we do interviews? There's a lot of different things emergency preparedness can do to try to help you out so you can actually go and do your job in environmental health. But language and law are important. So a lot of what I think, so in emergency preparedness, we use acronyms all the time. Same thing with environmental health. Our acronyms don't always jive with one another, and so certain things that I think are one thing, they think are another. So we have to be very specific about our language, kind of going back to PERC and tetrachloroethylene and all that. Like we have to be very cognizant of what language we're using. And then finally, law is incredibly important too. Environmental health, you guys are really great at knowing local laws and what's allowed in terms of environmental health, whereas preparedness people aren't versed on that. We know more of like the national law, like the Stafford Act and things like that, the PREP Act. But those can work together. We just have to make sure that we're talking to one another and ensuring that we are paying attention to each other's laws and knowing how everything is panning out and just kind of keeping everyone on the same page. So that incident command is incredibly essential to making sure those lines of communication are open between environmental health and emergency preparedness. So with that, I'm a couple minutes over what I wanted to be for you guys. So we have about 13 minutes for questions. I'd be happy to answer any questions at this point. On the slide, you have my email address. If you ever want any resources, please feel free to contact me, and I'll try to get you something to help you out. With that, I'll take questions.
And questions can be typed in the chat box at the bottom. Okay. Will the presentation be sent out? Yes, the presentation will be posted on the NEHA website under the preparedness page along with the slides, and that should be posted within the week. Any more questions?
I didn't do that great of a job. Come on, feel free to ask questions or ask for any resource. I'll be happy to try to find you something.
Okay, here's a question from Erin. In any of these scenarios, was EHGIS capabilities helpful?
Absolutely. So during the flooding especially, GIS was absolutely the best thing that we could have. We developed, our environmental health developed several layers, like there's one for our food establishment, one for our wellheads, and they were amazing. I have very limited knowledge in GIS. I know just enough to break things, and so they were absolutely helpful for us to do that. So they developed all of our maps for us, and we added those to our incident action plans for every operational period so people could look at what was still affected. Great question.
Any specific problems or outreach to schools?
I'm not exactly sure if you're asking about any of the specific incidences or just in general. If it's anything specific to any of those incidents, please let me know, but I'll speak a little bit. Oh, flooding. Actually, during the flooding, we were very fortunate that none of the schools were flooded. We have had incidents in the past where we had a contaminated water supply for one of our schools that had E. coli in their well, and so that was a bit of a challenge. But we did a lot of work with them on installing portable water supplies, and so that they wouldn't drink out of their water fountains, and sent home messaging with the kids. Hopefully that answers your question. If not, feel free to add more.
Again, if anyone has any questions, you could type it in the chat box at the bottom. How easy is it to work with federal agencies?
It's interesting. So I'll talk mostly about the vapor intrusion part of that. So we did a lot of work with our state, so the Michigan Department of Health and Human Services, MDHHS, and the Michigan Department of Environmental Quality. They were kind of the interface for us to work with EPA in vapor intrusion, and so everyone had kind of their own priorities. And so for us, we didn't have investigatory authority on this, and that's kind of where law gets to be very important. Who has what authority over each incident? And so for us, a lot of what we were trying to do was trying to get out good, credible information to the public about vapor intrusion, whereas we didn't have the capability to do the testing. So a lot of what MDEQ did was the initial testing, and then when EPA was brought on board, they helped with the public information, but also they brought their TAGA bus. There is no way we could have done all the sniffing in all the homes, because I think we ended up testing an additional almost 100 homes for this event. And so, I mean, the feds were great in this case. They really brought out the bells and whistles for what we needed to try to hurry up and end this event. I mean, it took several months to get this through. I mean, so every day we're getting new samples back, and we're kind of like crossing our fingers, like, please let those samples be low, please let them be low, or no detect, please, please, please. We don't want to have to try to evacuate more people out of their homes. And they did a lot of the door knocking along with DEQ. MDHHS was really helpful in that interface between EPA too, because they have the toxicologists. And so they were helping us interpret a lot of the data that we received back on the blood sampling too. So it was a really great partnership overall. But sometimes, like I said, language is important. So some of the acronyms we use and some of the understanding of who is responsible for what really needed to be communicated up front. But overall, it was a really good partnership.
Any more questions? So I have a question for you, Karla. Have you introduced to your strategic plan a way to incorporate neighboring counties and other areas in the state that may be impacted and may have to reach to you in order to help solve environmental health issues?
So in Michigan, we're actually divided up into 8 different regions, and Kent County is a part of Region 6. And we actually have a memorandum of understanding, as an MOU, between all of our health departments outlining that we can share staff for whatever reason that we need, and liabilities allowed under that MOU. So at this point, we have not had to use that, but we renew it about every 10 years, and that is definitely in place. And most of the regions do have that in place. So we've been very fortunate that we haven't had to use it. But during our Northern Exposure exercise, there was another part of that exercise where we did exercise utilizing that MOU. We requested staff from other health departments, and that included many sanitarians, to try to help us out with the food inspections and things like that. Also, the EPCs, the Emergency Preparedness Coordinators, are a very tight-knit group, and so if one calls for help, most of us are right there trying to help them out with whatever they might need.
Do you have any advice to other members of probably health departments throughout the country that are on this webinar on how to create a better relationship between EH and emergency management?
Overall, I'd say, just start talking. Try to break down some of those barriers. Even in Michigan, we have a range, honestly. I feel very fortunate that in my department, because we started going through FAB and PPHR, that relationship was already starting to kind of come to fruition. But in others, the emergency preparedness coordinator is like, well, I'm not environmental health. It's not my work plan. Why am I helping people with large foodborne outbreaks? And so we have that entire range. And so it really takes the right personalities, honestly. Like, both sides really have to be willing to communicate. But exercising, just even posing questions of like, what would you do if? That's huge. One of my first exercises here at Kent County was a continuity of operations exercise, and environmental health at the time had nothing but paper copies, and during my exercise I burned all their copies. Adam was not happy with me. Literally, I did not really burn their copies, but I told him, like, you don't have any paper copies anymore, they've all been burned down. Like I said, he was not pleased and made the exercise very challenging, and so it just kind of points out, hey, these are some things that we need to think about. And so also working with your senior leadership. And like I said, I'm very fortunate that my health officer, is the immediate past president of NEHA, so obviously he's in tune with environmental health, and then I sit in administration along with him, and so we have a lot of face-to-face, and we try to work together on the environmental health issues. So it takes a lot of pushing sometimes, but you can't push too hard that people get annoyed with you, because that doesn't work well either. So even just kind of posing questions and trying to learn the language. One of the things that I did was I ended up taking the REHS exam because of all the things that we've had in environmental health. I really wanted to be more knowledgeable so that when I'm talking to the environmental health staff, that I don't sound like a complete idiot, because I didn't know what certain things were or how inspections were done, or the logistics of things. So I feel that doing that has actually made me a better emergency preparedness coordinator by knowing more of environmental health. And so sometimes it might need to work the other way too. Learning ICS as an environmental health person kind of helps that interaction between emergency preparedness staff.
Well, Karla, thank you so much for taking the time and speaking at this webinar. We hope you found the value in this webinar today, and please be sure to fill out the webinar survey afterwards. Again, like I previously mentioned, this webinar will be posted on the preparedness page on the NEHA website within the week, along with the slides. If you have any questions or concerns, or if you're interested in any resources, please don't hesitate in emailing Karla or emailing me. My name is Christine Ortiz from NEHA. And again, thank you and have a wonderful afternoon.
Thank you, everyone.